I'm Patrick Vernon. I'm the interim chair of Birmingham and Solihull Integrated Care Board. So, November, we had our board meeting. This took place in person in Birmingham. Our chief exec, David Melbourne, shared some early positive reflections from our recent Care Quality Commission. We volunteered to be part of a pilot scheme on the inspection across the whole NHS system in Birmingham, Solihull. And it was really fantastic that we had some really good early feedback. I just want to personally thank the team within the Integrated Care Board who led on this work, and plus all our partners that got involved as part of this process. We'll have more details about that to share in the next month or two. We recently also reviewed the format of our board meetings. We felt that it was important to restructure meetings and the discussions so we could focus on our work in Birmingham and Solihull around place, the plans around our collaboratives. We have a mental health collaborative, we are launching a community care collaborative, and also an opportunity to have some real deep dives and conversations around big ticket items affecting the health and well-being of residents in Birmingham and Solihull. So one of the main items we discussed at our board meeting was we had a presentation from Healthwatch Birmingham and Solihull from the chief exec, Andy Cave, who gave us an update on their work to help us understand some of the challenges and issues of how we work together and the experience of patients. Healthwatch plays a critical role in advocating for patients in our system. And Andy, he set out 4 key next steps how we could work together much better in terms of Healthwatch and the ICB, based on their investigations and reports, looking at how we can look at the way that for our governance structures, particularly our quality committee, that we can measure the impact and results of the report to ensure the follow through their recommendations. We looked at how we can look at the experiences of patients with prostate cancer, how we can improve that care pathway, and also to look at the work that we are doing together around developing our work around community engagement in terms of the framework that we've just launched to celebrate action to make sure that patient insights and experiences influence our decision making and to get the feedback to help us run our commissioning of services. We also heard from Birmingham City Council, Graham Betts, who is the Executive Director for Adult Social Care, talking about the work of the Place Committee which he chairs, how the work is, the structures that we're developing are maturing. We also heard from Ruth Tennant, who gave an update in Solihull around their plans and their prioritisation around place. I think we're going in the right direction with both our place committees. I want to thank everyone who's involved on those 2 committees, helping as part of our work around delegating responsibility and resources. Our Chief Executive Officer, Paul Affey, he led a deep dive on our financial challenges that we are facing in our system, which you can appreciate is difficult for us, but we are working on various plans. We also heard from our Chief Delivery Officer, Mandy Negra, who gives a regular update on some of the key challenges around access to services, waiting times, and our general performance as a system. One of the decisions that we approved at our board in November was the strategic outline case for change for our community integrators. That was presented by Birmingham Community Healthcare Chief Executive Richard Kirby. We recognise that to tackle long-term standing inequalities in health and care and improve outcomes, it's essential that local services are delivered by multiple teams and care providers, particularly around integration and better coordination with local places, and that we're able to meet the diverse needs of individuals and communities. The collaborative will be an all-age partnership. It will bring together a range of service providers where we can integrate care for local people and where we can understand what truly matters to people around their communities as part of decision making. So we agree with the strategic online business case, which reflects the vision as an ICB, but also fits the work of the Birmingham Solihull Community Care Collaborative. This is still early days that we're doing the work, but we'll give more updates on the collaborative and how it will benefit you in terms of residents in Birmingham as well as in Solihull too. We also heard from a number of our colleagues from primary care on a number of papers that we also approved at the board. Sanando Ghosh, he chairs the General Practice Partnership Board, which represents GPs in Birmingham and Solihull, and they presented the draft BSOL Enabling Primary Care Strategy, which we approved. This strategy will help to support the work around extensive engagement within the primary care sector and to set out a future vision for the sector as well, which we hope to work in partnership with GP practices in Birmingham and Solihull. And then finally, Anna Hammond, who's Director of our GP Provider Support here at the ICB, also gave a presentation on our delivery plan around recovering access for primary care. The plan actually is in response to the National NHS England Delivery Plan around recovering access to primary care, and it kind of reflects the comprehensive transformation programme, Right Access First Time, developed in conjunction with GPs and the wider provider sector as well. Our next board meeting will take place in January, and actually this will take place in our new offices in Alpha Tower in Birmingham. Thank you for listening, and please see information about the work that we do at ICB on our social media platforms and our website. Thank you.